and now I'm talking to Professor Joe Barry from Trinity College. Joe, how's it going? Joe, could you tell our listeners first, please, exactly what your job is here?
Oh, I'm the Professor of Population Health in Trinity College. What that means really is my job is to do research and teaching and public advocacy about public health matters. What I do mostly is around substance use, whether that's illegal drugs, prescription drugs, alcohol, but also other sort of health issues like diet, physical activity, looking after yourself. So we teach medical students and postgraduate students here in Trinity, and I also work with the Health Service Executive in their Health and Wellbeing Division, where we look at trying, make recommendations to the public about the ways that they can help themselves to be healthy and to stay healthy.
Yeah, that's great. You have a big interest in trying to combat the misuse of legal and illegal drugs, don't you?
Yeah, part of what I do is we have all the surveys that we have done in Ireland show that we like our drugs in this country, whether they're prescribed, bought off the street, tablets, big problem now, heroin, and alcohol. So those are the types of categories of drugs, cannabis as well. Those are the categories of drugs that a lot of Irish people take a lot of.
I'd like to focus today mainly on alcohol abuse because there's a new bill planned to be brought in, new act, the Public Health Alcohol Act, and I think personally that alcohol damages the biggest number of people in Ireland compared to other drugs. So I'd like to talk to you again at some other stage, maybe after the act comes in, about illegal drugs and other legal drugs as well. The bill that's supposed to come in, it's called the Public Health Alcohol Bill. I'm right in saying that you are a supporter of this new bill, and could you tell us if the bill is good enough in your opinion in terms of the research on alcohol abuse in Ireland and internationally?
Well, I think the bill is a good start. I mean, the Department of Health has never published any legislation about alcohol. All the alcohol legislation we have in this country has come from the Department of Justice, and that's really about licensing. When I grew up in a small town down in Cork, we had about 60 pubs, and that wasn't exceptional. Every town had lots of pubs. Now the pubs, that sort of culture has changed a bit. There are less pubs than there were, but they're off licenses, and in particular the supermarkets are the biggest problem now that we have because they sell drink so cheaply. So alcohol is a big problem, and the bill. The only other time that the Irish state really tried to do something about health and drink was the drink driving legislation, which was opposed by the industry and lots of people, but has come in and has actually reduced the deaths on the road by an awful lot. So it has been very successful. And what this bill is doing now, that's been published by Minister Leo Varadkar, it's an attempt to implement in Ireland a couple of the types of policies that have been shown in other countries to be effective and that are endorsed by the World Health Organization. That's things like minimum unit pricing, where it would be illegal for supermarkets to sell very cheap drink like they do at the moment, and also that there would be labels, health labels, calorie labels, content labels on alcohol bottles, which are not there at the moment. Which the industry has resisted. And the third area then is about some restrictions on marketing. Now the restrictions on the marketing are the weakest bit of the bill. My own view is that we should really have no advertising of alcohol. There's plenty demand for alcohol already. If the reason I'm involved in this work is I see the harms that are caused, and part of our role is to look at the evidence, what works, and say to the people of Ireland in programs like this, there are things that can be done that will lessen the harms, because there's hardly a family that hasn't had some impact from alcohol, whether it's suicide, house fires, drownings, people clogging up emergency departments in hospitals, people with mental health issues, other very, very big problems that we have in Ireland.
People getting killed, physically killed.
About half of all homicides, lads go out for a Saturday night, they're not bad people, they're just out, drink too much, somebody pulls out a knife and somebody's dead. And that's not intentional, but it happens. And I mean, I drink myself, and if you have a few drinks, you're not quite the same person before you had them, because your judgment is not quite as good. People get into fights when they're drunk, and you don't have to be drunk to harm yourself. Steady, heavy drinking can cause problems for men and women in different ways. Sexual crime, you have rapes where neither the victim nor the perpetrator can remember what happened, so there's no court cases. Domestic violence is a big problem. It's a hidden problem in Ireland, and it's something that people don't like to talk about. And a lot of the reports that have looked at dreadful cases of child abuse within families being linked very much to alcohol. So the alcohol industry is just making profits on all this misery, and that really has to stop. But it'll only stop if more people sort of really think this is a problem and say it and talk to their TDs, talk to local councillors, and demand that more protections are put in place. Break the link between sport and alcohol as well.
Yeah, I was in college in Cláiste Dúlaigh in Coolock there about 10 years ago, doing journalism, and I did a report on alcohol advertising on television, and it's kind of self-explanatory. I know everyone knows this, I suppose, if you think about it for more than a minute, but just I advertised a few alcohol advertising ads on the television, and they really do use the most sophisticated marketing techniques using sex, colour, power, everything that you can think of. And it's true to say, isn't it, that the last Minister for Health before Leo Varadkar was there, Dr. James Riley, was there for about 2 years or something. He was really a champion on this, wasn't he?
Well, he was, and in fairness to Minister Varadkar, he is actually the guy who has published the bill. So I think he does see the benefits of having legislation. Most politicians, it takes a while to get legislation into effect in Ireland or lots of countries, but nearly always when politicians do act, they do get praised. So I hope the bill does get turned into law. It will be opposed by the alcohol industry. They've opposed the Scottish government, which are trying to do similar things, and obviously Scotland is very like Ireland in terms of our culture. Half the Scots are Irish originally, and we drink in the same way, and the Scots Independent Parliament is trying to bring in minimum unit pricing, and they've been challenged in the European courts.
And the Diageo, wasn't it? I think it is.
Well, I think it was sort of the European spirits manufacturers. There was a few other, there's a lot of these companies that are funded by the alcohol industry. They're making big profits. That's all they want to do. They talk about being worried. I don't believe it. I don't really accept their bona fides on this, because they're making too much money, and they're the people who've got a lot of money, or companies that make a lot of money, they don't want to give it up. They're getting grants from the state, which is scandalous for some of their plants, and they're leading Ireland the merry dance, and our people are suffering because of it.
No, I just talking about Dr. James Riley. I remember seeing him. I heard of him talk about this when he was in opposition before 2011. But I saw him on primetime once about 4 years ago, and he said that like sports competitions and sports teams, instead of having Heineken, European Cup or Rugby Cup or whatever it's called, have like Google sponsored or something. He was very passionate about that.
Yeah, I mean, I think obviously sponsorship helps sporting bodies. I just don't think the alcohol company should be allowed. I mean, in the past the banks sponsored sport, and the banks are half broke now. But there's telecoms companies, phone companies, insurance companies. There's some companies that make a lot of money and are happy to put it back. Utilities. It shouldn't be alcohol. Alcohol and sport should not mix. Elite sports persons don't drink. But there is relentless marketing by the alcohol industry, and the Minister for Sport and the Junior Minister for Sport have essentially done nothing about it.
I was talking to Alcohol Action Ireland there recently, and they're saying that one of the next frontiers as regards tackling alcohol abuse marketing is on the internet. Were you disappointed to see the ad that Conor McGregor did recently? Like, it's not been shown on television in Ireland because it wasn't allowed to be shown, but it's allowed to be shown on the internet. Are you disappointed with that?
Yeah, I think it's a pity because obviously Conor McGregor is a very popular sportsman, and he's got a big recognisable brand, and I wouldn't like to think that people get drunk on Budweiser and start trying to do things that he does inside in the cage. So it's a pity. I mean, I don't know whether he was involved in it or whether he gave his permission, but there is a big link between alcohol and street fighting, particularly on our weekend nights. So really linking extreme sports and mixed martial arts and that with alcohol, I think, is a bad idea.
You're on the board for Alcohol Action Ireland, aren't you? Could you tell us a bit about them? What you do with them?
Well, alcohol, yes, I'm on the board. There's about 10 of us on the board. We've got 2.5 people working with us, so it's actually quite a small organisation that does an awful lot of work, produces a lot of very good information, makes, I think, obviously quite important public statements on alcohol. All of us who are on the board, we come from a whole variety of backgrounds. There's a couple of doctors, a couple of people from other health areas, some people from the private sector, some people from the community sector. So it's a mixed bunch of people who we're all Irish people who believe something needs to be done about our alcohol problem. That's what brings us together. And we have terrific staff, and we have researched what works, because there has been a lot of evidence of what works in other countries, and we lobbied for the drink driving legislation to be brought in, and we were resisted for about 10 years. Eventually, when it came in, it has resulted in a halving of the road deaths, so that's very effective. And there are other measures like the minimum unit pricing, which is targeting at very young drinkers who've got little money and very heavy drinkers. And the alcohol industry is opposing that because their profits are more important to them than the health of the Irish people. And anybody who doesn't believe that is being very naive, in particular our politicians and the European politicians. There are big problems from alcohol across Europe. We have it worse than most countries. But even the developing world are trying to spread it in Africa. And, Africans have enough problems already without being saturated with Guinness.
Do you find it very disappointing to see that politician down in Kerry, Michael Healy-Rae, and maybe his brother, as Danny Healy-Rae, say that they think that you should be allowed to drink more alcohol and drive?
Oh, well, drinking and driving is a problem in Ireland, and it's less a problem than it was because of the legislation. I think if people want to drink and go to the pub, and I do that myself, I don't drive, and that's as it should be. And you either drink or you drive, but you don't do the two of them together.
Okay, Joe, finally, what is your message to the incoming Minister for Health and the government, and indeed to our listeners listening today, on the public health alcohol bill and how they can support it?
Well, my message, I suppose, to the incoming government is to continue with what was begun by Minister Leo Varadkar. We don't know who the new minister will be, but the bill has gone through a couple of stages of the Oireachtas, and it just has to do a little bit more, and then hopefully our 32nd Dáil will pass it, and it'll eventually become an act of our Oireachtas and come into law. And the public, I think, can lobby for that. I know people have lots of problems at the moment, mortgages and not a lot of spare money in that, but this is an important issue that affects most families, and politicians in Ireland are very accessible. You can go down any Saturday, usually morning, local TD, you can call in, they'll see you, they'll listen to you, and tell them that this is a problem and ask them to support the bill. And if as a politician saying drinking and driving is okay, I'd ask people to go into them and say no, it's not. I think that the other people that I would, if you're a parent who's got young children playing sport, which is a great thing to do as a youngster, I think you need to know that there is a link between sports sponsorship by alcohol companies and early starting to drinking. So I think you should ask whether it is the rugby union, who are the worst, the FAI soccer, which is the most popular sport in the country, or Gaelic games, particularly those three big organisations. You should, as a parent of a child playing, boy or girl playing one of those sports, say to the local club, listen, I want you to ask the relevant organisation to stop taking money from alcohol companies.
Okay, Joe, thanks very much.
You're welcome, Darren.
I'll talk to you again.